Kennedy Jr. has a past that has smears on it when it comes to following the science and respecting science. That's why there's skepticism. So let's bring in one of the 17 panelists who was let go, Dr. Noel Brewer. Doc, thank you for joining me. What do you think this is about? What's your concern?
My concern is that we've taken 60 years of efforts to build trust among healthcare providers in the recommendations of the advisory committee through CDC, and that trust just evaporated overnight. It's going to be hard to get that back. Whatever this new ACIP panel is, I look forward to it, and I certainly hope that they can quickly regain that trust. It's necessary for physicians and other healthcare providers to do their work.
Well, if you look forward to what it's going to be, how do you know that it necessarily loses the trust?
It's gone. It's not there anymore. The American Academy of Pediatrics is no longer following CDC guidelines. The move by the Department of Health and Human Services to identify a new set of criteria for COVID-19 vaccination has meant that it's no longer coordinating with any of the professional societies, and all of that was harmonized before. So in multiple ways, there's been a rift that's been going on for a few months now, and this new move has evaporated all trust. So they're gonna have to work quickly to rebuild that.
So Bobby's dealing with another type of trust, which is people who don't trust the vaccine and say, hey, it's not a vaccine, it's a therapeutic, and that you guys, not you, but that, you people, right, in quotes, knew that it was going to make people sick, that it wasn't working on the later variants, and you didn't talk about it, and you kept going with it. So that's the trust that he's working on.
I hear you, Chris, but let me ask you this question. If I ran into you at a bar last night having a beer, and I asked you, what do you know about this ACIP committee? And you'd be, I don't know. I mean, well, maybe you do know a little bit about it, but it's pretty arcane. I don't think most Americans even care that much about it. And now that there's all this news and people like me out from our ivory towers, it's generating interest, but I don't think that the impact here is going to be primarily among the general public. Among a core group of vaccine skeptical folks, it will certainly resonate and maybe have some meaning, and maybe there are additional actions. But right now, the main group that's being harmed are healthcare providers who no longer have an authoritative source to look to.
Doctor, I appreciate your perspective. Thank you very much, Dr. Noel Brewer. If you learn things going forward that you think matter in terms of understanding what this is about, we're a call away. Thanks, Doc. All right, let's bring in the CDC, the man who ran the CDC under Trump's first administration, Dr. Bob Redfield. It's good to see you, Doc. Do you think this is ill-advised or well-advised?
You know, Chris, I think to get at the issue is trust, public trust, not trust of academic organizations or different, societies. It's about the public. And we really lost trust in the public about the power of vaccines. I believe vaccines are the most important gift of science to modern medicine. When I was CDC director, I was very disturbed that over half of the population didn't get the flu vaccine. And so I started a campaign rather than vaccine hesitancy for vaccination with confidence. Well, then the COVID pandemic came. And I have to say, although I have a lot of respect for Noel and the other people on the committee, the reality is the guidance that came out of the ACIP for COVID vaccines, I think in general was ill-advised. There was never any scientific basis for this vaccine to be prioritized for children, right? That this vaccine does not prevent infection. The statement that get vaccinated so that when you go visit grandma, you won't get grandma infected. There's no scientific basis for that statement. And as a consequence, and maybe you can comment on this, I think a lot of the public lost trust in our vaccine policies. And I think what Secretary Kennedy is trying to do is to go on a path to rebuild trust. As you noted, 13 of the 17 members of this committee were appointed in 2024. There was another one that was extended. So 14 of the members, and they have a 4-year term. So nobody would be changed until 2028. I think Kennedy decided he's worried about conflicts. He's worried about corporate capture, and he's worried about the reality. But this committee recommended the COVID vaccine for children over the age of 6 months, almost unanimously. He wants to get new blood in the committee and have more, debate, more controversy. You and I know it doesn't help to have a committee where you get a vote 17-0. You need to have more disagreement, more debate. And I think, that's what Kennedy's doing. I have 100% confidence in Kennedy. I don't think he's doing this because of any anti-vaccine. I think he's doing it for vaccine transparency.
Well,
and I think it's a consequence of the mistakes that were made in the previous ACIP in recommending this vaccine where it didn't belong.
well, let's see who he puts on it, right? The proof will be in the positioning. So we'll see who he puts on it and what they're about, and then we'll circle back and discuss it. Doc, always a pleasure. Thank you for your perspective.
Yeah, thanks. Okay, God bless you. Yeah,
All right,
take care.
be well, Bob. Thank you for watching. Subscribe below and download our NewsNation app right now on your phone, and you will get fact-based, unbiased news for all Americans.